Welcome to our channel. Today, we're going to unravel the mystery of a C-section birth. You might be wondering, what is a C-section? Well, in simple terms, a C-section or cesarean section is a surgical procedure where a baby is delivered through incisions made in the mother's abdomen and uterus. It's a common method of birth, used in various situations. Now, why might a C-section be necessary? There are several reasons. For instance, if there are complications during labor, such as fetal distress, breech presentation, or placenta previa, a C-section might be the safest option. Other times, a C-section could be planned in advance due to medical reasons or if the mother has had a previous C-section. It's a crucial tool in the world of childbirth, ensuring the health and well-being of both mother and baby. Now that we've covered the basics, let's delve into the procedure itself. So, what happens during a C-section? Well, let's dive into the step-by-step process. The procedure typically starts with the administration of anesthesia, usually in the form of a spinal block or epidural, to numb the lower half of the mother's body. This ensures the mother is comfortable and pain-free during the procedure, while remaining awake to meet her new arrival. Once the anesthesia is in effect, the medical team will prepare the mother's abdomen for surgery. This often involves cleaning the area to reduce the risk of infection. Following this, the surgeon makes the first incision in the lower abdomen, usually along what's called the bikini line. This incision is typically about 4 to 6 inches long. Next, the surgeon makes a second incision in the uterus. This is where the magic happens. The incision is made large enough for the baby to fit through, but not so large as to cause unnecessary damage. Once the incisions are made, the surgeon reaches into the uterus, gently lifts out the baby, and the long-awaited moment arrives: the birth of the baby. After the baby is safely delivered, the umbilical cord is cut, and the baby is handed off to a pediatric team for immediate care. While this is happening, the surgeon removes the placenta from the uterus and begins the process of closing the incisions. Closing the incisions is a meticulous process. The uterus is stitched up with dissolvable stitches, and the abdominal incision is closed. Depending on the situation, the surgeon may use stitches or staples for the outer incision. Finally, a dressing is applied to the wound to keep it clean and protected as it begins the healing process. From start to finish, a typical C-section can take anywhere from 45 minutes to an hour. So that's how a C-section is performed. But what about recovery? Recovery after a C-section can vary, but here are some tips. The journey back to wellness post-surgery is an individual one, but it's important to remember that you're not alone. Firstly, heed your doctor's advice closely. They will provide detailed post-operative instructions tailored to your specific needs. Following these guidelines will aid in a smooth recovery and help prevent complications. Next, be mindful of managing your pain. Your doctor will likely prescribe pain medication to ease any discomfort. It's crucial to take these as directed to help in your healing process. Rest is also a vital part of recovery. While new mothers are often eager to get back to their routines, it's important to let your body recuperate. Make sure to take ample time to rest, sleep, and nourish your body with wholesome foods. Avoid heavy lifting and strenuous activity in the initial weeks following surgery. Your body has undergone a major procedure and needs time to heal. Overexertion can lead to complications, so be sure to pace yourself and ask for help when needed. Lastly, remember that it's okay to seek support. Whether it's from your healthcare provider, family, or a community of other mothers who've experienced a C-section, don't hesitate to reach out. Remember, despite the initial challenges, a C-section can be a safe and necessary procedure for the health and well-being of both mother and baby. That's it for today's video. We've unraveled the C-section birth, from understanding what it is, to the reasons it might be necessary, the procedure itself, and recovery tips. Remember, every birth is unique, and a C-section can be a safe choice ensuring health and well-being. If you found this video beneficial, show us some love by liking, sharing, and subscribing. We're committed to providing you with more enlightening content. Until next time, take care.